Hi everyone, welcome back to my YouTube channel and today we are going to talk about maxilla. So let's start our topic with introduction. Maxilla is pair of irregularly shaped facial bone that fuse in midline to form the upper jaw. They play a vital role in structure of face, formation of orbit, nasal cavity and palate and also in the housing of upper teeth. Because of their central location and multiple connection, the maxilla are often referred as keystone bones of the face. Location and structure of maxilla. It is located centrally in the midface between the orbits and above the upper teeth. Each maxilla consists of a body and four processes that include frontal process, zygomatic process, alveolar process, and palatine process. Two maxilla join at intermaxillary suture in the midline. Parts of maxilla include body, frontal process, zygomatic process, and alveolar process and palatine process. Now let's talk about these parts of maxilla one by one. So first part of maxilla is its body. It is the central part of the bone. It contains maxillary sinus that is the largest of paranasal sinuses. Surfaces of body of maxilla include anterior surface, orbital surface, infratemporal surface and nasal surface. Anterior surface of body of maxilla forms the upper jaw and contains the infraorbital foramen for passage of infraorbital nerve and vessels. Orbital surface of body of maxilla form part of the floor of the orbit. Infratemporal surface of body of maxilla contributes to the infratemporal fossa and nasal surface of body of maxilla form part of lateral wall of nasal cavity. Next part of maxilla is frontal process that project upward to articulate with frontal bone. They form part of lateral boundary of nasal cavity and medial wall of the orbit. The third part of maxilla is zygomatic process. They project laterally to articulate with zygomatic bone, thus helping form the cheek prominence. Next part of maxilla is alveolar process. They contain the socket for upper teeth. They are strong and curved and they form the upper dental arch. Fifth part of maxilla is palatine process. It projects medially to join its fellow from the opposite side. This palatine process forms the anterior 3/4 of the hard palate and it fuses at the intermaxillary suture in the midline. Important features of maxilla include maxillary sinus, that is a large pyramidal air cavity that opens into the nasal cavity, thus lightening the skull and resonating the voice. Second feature of the maxilla is infraorbital foramen that are passages for infraorbital nerve and vessels. Third feature is alveoli that are sockets for upper teeth. Fourth feature is incisive foramen that are opening in the hard palate behind the incisor teeth for passage of incisive nerve and vessels. Articulations of maxilla. Each maxilla articulates with 9 bones that includes its articulation with cranial bones and its articulation with facial bone. Talking about maxillary articulation with cranial bone, maxilla articulate with frontal bone and ethmoid bone. Talking about its articulation with facial bones, maxilla articulate with nasal bone, zygomatic bone, lacrimal bone, palatine bone, vomer, inferior nasal conchae, and it also articulates with opposite maxilla and intermaxillary suture. Functions of maxilla. First function is support as this bone forms the upper jaw and holds the upper teeth. Second function is spatial structure as this bone contributes to the orbit, nasal cavity and hard palate. Third function is air passage as this bone houses the maxillary sinus aiding in respiration and resonance of the voice. Fourth function is protection as this bone protects important neurovascular structures like the infraorbital nerve. Fifth function is mastication and speech as this bone provides anchorage for teeth, thus enabling chewing and articulation of speech. Conclusion of this lecture video. Maxilla is a paired facial bone that forms the upper jaw, plays a major role in architecture of face and contributes to multiple cavities including orbital cavity, nasal cavity and oral cavity. Its processes and sinuses make it both structurally and functionally essential. As the keystone of the face, maxilla ensures stability and integration of surrounding facial bone, while also supporting vital functions such as breathing, chewing, and speaking. And this was all about maxillary bone. Hopefully, you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.